The date is the 25th of October on a Tuesday, and it is a morning for others and an afternoon for others. But in whichever part of the world would like to greet you today, WeMove, and would like to welcome you to the WeMove Adolescent Health Webinar. This is hosted by the Desmond Tutu Health Foundation and International AIDS Vaccine Initiative, in short, IAVI. My name is Ntando Yola. I am the Community Engagement Lead at the Desmond Tutu Health Foundation, and I am delighted to be chairing this session today and really facilitating an engagement on this important subject. So at this point, I would really like to thank you all for joining us today, and we're really looking forward to an interesting and an interactive and a vibrant session, because it's about young people. It is about adolescent health research. Now, this is the fifth of the 6 webinars in 2023 WeMove series. And today we're going to be focusing on community engagement, as we have mentioned, in HIV and health research. We will hear talks from a group of speakers, well, about 2 speakers who are bringing both personal experiences in terms of their professional work and backing up their experiences in this kind of work with academic work. And that will be Dr. Michele Andrasik and Dr. Rosemary Musesengwa. And in between, we will be having an artistic performance from Loti Makoti. This will be followed by a panel discussion where our speakers will be joined by other 2 vibrant and exciting speakers who are bringing us very much the life experiences in terms of the work and in terms of the community work that they are involved in. And that will be John Mdluli of the Oram Institute and Simthandile Mputa who is a community advisory board member of the Desmond Tutu Health Foundation. And Simthandile serves as the chairperson. She actually has recently been elected in the past week as the chairperson. We're delighted to have you all here. Now, to start off, we'd like to know a little more about what you think, and we have a quick poll question. So please look out for the poll, which will appear on your screens. And please complete it by clicking on your preferred responses on the screen. This is completely anonymous, so please do not worry if we are going to know who you are. So here are the questions that we'd really like to consider. Please go ahead and fill in the questions on the poll. And of course, the questions are about if health researchers collaborate with young people to gain better understanding of their thought processes in relation to health research, what do you think? Or to increase enrollment of youth in health research? Are they doing it to meet the global and local guidelines on the involvement of young people in health research? Or are they there to encourage sexual risk avoidance education? Or is it there to empower and educate young people about the implementation of health research? Or do you think this is all of the above, or in fact, none of the above? Please go ahead, and we are seeing the poll coming through. So as soon as we think all of you have voted, we are going to end the poll. I think we still have a few who are who still need to do the poll, and hope we are all able, even if you are joining on your mobile. Please continue voting. We are at about 79%. So as you are waiting at 84%, and please do like Talita Makofana has done, as we continue hearing from all our speakers and panelists. And Talita has just showed us the way, introduced herself, and please do that as well on the chat box. and then we're going to use the question and answer option as well to answer questions. All right, so I think I guess most of us are not able to continue voting, so we kind of are going to have to live with the 87% of participants, which I think is really a good mark. And I think all of you are really agreeing, well, not all of you, but most of you agree that health researchers collaborate with young people in research to gain better understanding of their thought process in relation to health research, which I think is really the reason why we actually need to engage and collaborate with young people, be it in research or in any developmental work that we do, because through doing that, we are able to really gain a better understanding and in fact have our work informed by the population that we're looking to work with. But I think about 2% of you actually highlight an important, in fact, agree with an important aspect that we do this to meet the global and local guidelines on the involvement of young people in health research. And I think that both of those are really good considerations for engaging young people in health research so that we are able to have them involved, to gain understanding from them, but also hear from them about what is important, what is their priority, and what are their needs in around health research. But also, most importantly, there's a range of guidelines that really help us, which are global and local, on how we are to involve young people in health research. So I think at this point, we're really going to go ahead with our session, and I'm going to introduce to you our first speaker. But please remember to use the chat box to introduce yourself, as well as use the question and answer as we are hearing from our speakers. Our first speaker, as I had mentioned, is someone that I have known and someone that I have worked a lot with, Dr. Michele Andrasik, and who works as a clinical health, well, she is a clinical health psychologist working to build and enhance partnerships with marginalized communities in clinical research. Her focus is on ongoing vaccine trials for HIV and COVID-19. She works as the Director of Social Behavioral Science and Community Engagement for the Fred Hutchinson-based HIV Vaccine Trials Network, in short HVTN, and the COVID-19 Prevention Network's Senior Staff Scientist in the Fred Hutchinson Vaccine and Infectious Disease Division, and an affiliate clinical professor in the Department of Global Health and Occupational and Environmental Medicine at the University of Washington. Dr. Andrasik brings expertise in community engagement, implicit bias and historical trauma, and the utilization of community-based participatory research approaches and qualitative research methods. And her presentation today to us is utilizing a robust HIV prevention framework to engage communities. Over to you, Michele.
Hello, my name is Michele Andrasik. I'd like to thank the organizers for inviting me to participate in the webinar today. For the next 15 minutes or so, I'm going to give you a pretty high-level overview of the HIV prevention framework that we have utilized to engage communities in the HIV Vaccine Trials Network, or the HVTN. The foundation of our community engagement work is a core belief that in order to foster trust and mutual understanding with the communities that we work with, it is critical that we engage these community members consistently and continuously. One of the things that we constantly say is that it is critical to engage communities early and often. When you hear about community engagement, what we often hear is that communities are mistrustful or distrustful. And we urge you actually to flip that around and to really think about what are we doing as scientists, as researchers, as clinical trialists to establish our reputations of trustworthiness. Because why should people trust us? And it's critical to ensure that what we're doing is fostering trustworthiness among the communities that we work with. And this community engagement really is a shared responsibility. And that's a shared responsibility with everyone at the clinic, in the network, in the cabs. It's really something that leadership needs to embrace, that all staff members, community stakeholders, advisory boards have to take on as their responsibility. And what we do at the HVTN Leadership Operations Center is really provide support and capacity building for the clinical research sites that are on the ground developing their locally focused engagement plans to reach diverse populations. And at the center of all of this is utilizing best practices that are available in the literature and really building on the lessons that we've learned over the years to move our work forward. And now I'm going to talk about some of the critical components of community engagement. The first is really identifying and engaging your priority populations. And when thinking about your priority populations, I know many of you are working with adolescents and young adults. And that's one of their identities. And it's important to think about all of the other multiple intersecting identities that people have, something called intersectionality. So not only do people identify as youth or adolescents, young adults, but they may also identify as a racial or ethnic minority. Whether or not they're a student or employed, whether or not they have pre-existing conditions, whether or not they're part of a community that experiences health disparities. These are all identities that may be really critical to the person, and it's really important and imperative that all of the activities that you work on in your community engagement are tailored for each of your priority populations, keeping in mind their intersecting identities. And this really requires that your community engagement efforts with regard to research, outreach, engagement, and recruitment are tailored for those specific priority communities. And it's really important that in your work, you build and maintain relationships with communities, with community stakeholders, with experts, maybe from other disciplines, other areas, working with those same communities. The second is we utilize community-based participatory research, or CBPR approaches, to develop all of our materials. And this requires that community is involved from the very beginning. We identify places in the process of materials development where we can reach out to communities, sort of show them where we are, get their feedback, get their guidance. And what we found is that doing this guarantees that the materials that we create are comprehensible, that they're inclusive, and that they use respectful language across the work that we do. The third approach that we take on is, again, developing activities that involve communities early and often. And we do this in three separate ways. One is by convening community working groups who have familiarity with research to discuss some of the issues that are coming up in their communities, to vet all of our research materials, and to really liaise between us and our communities. Our community working groups, are generally comprised of CAB members at our sites, at our clinical research sites, community educators, community stakeholders, and we convene them uh, pretty regularly when we have active protocols and active trials in place. And we still convene these groups even when we don't have active protocols in those areas to stay abreast and to maintain those relationships and those connections. The second thing that we've done, something that we implemented in our COVID work, is convening priority population expert panels. And we have continued our robust faith initiative, which was established in HIV, that we've been able to grow in our COVID efforts and since expand that growth to our HIV efforts. And I'm going to talk about the expert panels and the faith initiative in detail on the next slide. So our priority population expert panels really came out of our COVID work. When we found that we would be pivoting to COVID in March of 2020, we reached out to several of our community stakeholders, asking them what they thought would be necessary to ensure diversity and inclusion in our COVID trials. And one of our stakeholders from our Native and Indigenous communities here in the US suggested that we create expert panels that were modeled on NIH review panels. And these panels, we developed one for each of our priority populations. We vetted experts, academic experts, research experts, clinical trial, policy, and advocates to join this expert panel or these expert panels. Each expert panel was comprised of experts who not only identified with the priority population, but also had spent their entire career working with and within that population. And these panelists reviewed all of our protocols and informed consent materials and generated reports detailing priority population considerations for each of the protocols. And then we were able to act proactively to implement some of the suggestions of these groups to ensure diversity and inclusion of our priority populations. Our faith initiative has been around in our HIV work for over a decade, and we were able through COVID to expand this. Our faith initiative had previously been one person doing the work, largely focused in the US. With COVID, we were able to expand this, creating faith ambassadors that were geographically distributed across the US. We were able to expand the clergy that we reached out to, help collaborate with these individuals to hold quarterly meetings, webinars, and listening sessions. So, and the faith initiative really is focused on making sure that we're communicating science to faith communities so that they can distribute it within their faith institutions to their appropriate constituencies. And then the fourth strategy that we utilize for community engagement is really around marketing and communications. And in COVID, we were really able to ramp up our marketing and communications because we, for the first time ever, had a solid collaboration with a marketing team and a communications team. So we were able to develop a faith or a communications toolkit, and I'll show you sort of some of the things that we developed. We were able to develop print materials in English, Spanish, and Portuguese. We developed a link on Dropbox and a password that all of our community partners, our clinical research sites, could access. We had Facebook, Instagram, and Twitter accounts for these materials, and we were able to launch a community-informed campaign. And this entire campaign involved community from the very beginning. And the community provided guidance and direction to develop what you're seeing here. Something that was a call to action, which the community felt was incredibly important, and something that was inclusive of the diversity of people that we wanted to be in our trials. So these are some of the advertisements on Twitter, social media, TV that we had. Some more here. You can see the diversity and the pictures. And all of our materials and marketing were really driving people to a registry. For the first time ever in our COVID efforts, we had a national registry in the US where people could go and sign up. And we were able to sign up over 700,000 people in the registry. And that registry led to the creation of a registry that we're now using for our US-based HIV vaccine trials. It's called the Red Ribbon Registry. And that Red Ribbon Registry is accompanied by a community-informed marketing campaign, HIV and All of Us. Something that our community thought was really important was having this be about all of us and the impact of HIV on our communities, an impact that's often not recognized by the general community in the United States. And then finally, our fifth strategy is really about engaging stakeholders and building trust, utilizing the relationships that we have with national organizations, local organizations, to really identify the needs of the community, what we need to do to increase awareness, education, and working with these stakeholders and community members to sponsor town halls and listening sessions and really making sure that the information is getting out to the communities that need it. So in all of these efforts, I think it's really important to note that for COVID, we were able, across all of the COVID vaccine trials that we have data for, recruit 47% of Black, Indigenous, and people of color into our trials. And we see similar results in our HIV vaccine trials, where we have over 35% BIPOC individuals in our trials, which again, you know, the gold standard would be to include people that are most disproportionately impacted by HIV, and that's where we're heading. And where we are right now is that we are at least recruiting and retaining people who match the composition of the larger US population. So moving forward, I think it's really important that we make sure that we are ensuring that we're reaching communities who are most impacted by the disease outcomes that we're working on, and making sure that we are utilizing efforts that will ensure that our communities are well informed, that they're supported, and that we have meaningful reciprocal relationships that increase trust, and that we're working to develop our reputations of trustworthiness. So remember, engage communities early and often, focus on maintaining meaningful and reciprocal relationships, and ensure that communities are engaged early and often. And before I leave, I just want to acknowledge all of the participants in our HIV and our COVID vaccine trials. To date, we have over 150,000 volunteers in those. A special thanks to all of our community partners and for our funder, the NIH. Thank you so much for inviting me here again today.
Michele, thank you very much. And I think it's interesting to note the 150,000 participants who have actually informed all what you have shared with us in terms of the experiences of the HVTN and CoVPN in HIV vaccine. and COVID research. And that was Dr. Michele Andrasik, everybody, and you are part of the WeMove Adolescent webinar today, and we'd really like to welcome you, and please continue to ask your questions on the question and answer option. But please, we'd like to know who you are. Introduce yourself on the chat box, and as we continue this. And I think, Michele, this has really been great because you really have highlighted overall very important principles as we conduct research and engagement with different populations, that a combination of best practices, listening to communities, as well as academic evidence is a good approach for effectively engaging communities, because this helps us to be able to maintain relationships, build trust, and have our research to be fully informed and guided by community voices. Thank you very much. So we move right along, and we have our artist today to make all of this very exciting and not just about engaging, but really to be entertained and actually get some messaging. We have Loti Makoti, who is a writer, performer, and theater maker, who trained at the Market Theatre Lab and UCT, University of Cape Town, respectively. His most recent work is Misms. I think that's how you say it. And Loti is here, is going to help us in actually saying that was part of the National Arts Festival in 2022. The first play, Loti's explanation of this piece of work, and then and this is all of the work that he has done. Loti, are you here? Can you say hello? Can we hear your voice?
Greetings, everybody. Yes, I am here, alive and well. How is everybody doing?
Thank you. Can you help me say that ismism?
Ism. So it's from the suffix ism. So it's a made-up term, so to speak.
Say it again for us, please.
Ism.
Thank you very much. That's exciting. And we'll launch right into the performance by Loti Makoti.
Would you like me to speak you through the work, or are you going to start off with the video?
I am addressing censorship within conservative communities.
Okay, we're hearing
and how that affects young children who may not be as educated about the health or healthy relationships, healthy sexual relationships, that if one is not educated in a space that is safe, in a space where they are within the guidance of their parents and elderly people, they risk being educated in spaces that may potentially be toxic because of the languaging around sex and sexuality among young boys, not only among young boys but among young people, and what the approach is, because if one is only educated in those spaces, in those toxic spaces, one hardly ever learns about safe ways or rather safe ways, safe sexual behaviors, or rather healthy ones. So that in a nutshell is what I was aiming to achieve with this one piece. Thank you. A Sepedi proverb. Ngwana a sa kweng molao wa batswadi o tla kwa wa manong. A child that does not hear the exhortations of their parents will hear that of the wild animals. We do not talk about it here. We don't even say its name, that word. The children deny knowing about it if they're ever to be asked. But they giggle when they hear the word. Grow up and find metaphors and suggestive euphemisms. The consumption of fruits, the playing of sports, references to the weather or animals or various other options. And you can tell by our giggles, our sinister smiles, our efforts to avoid eye contact that we're referring to it. We don't talk about it. It stays behind closed doors like a thing of shame, a thing that is meant to be hidden. The secrecy and shame has become a culture adopted from one generation to another. To young boys, it is likened to a soccer match. Slugger proposes a game, no Selena. That's intercourse. Starting lineup on both ends, the meet and greet. Formations, 4-4-2, attacking strategy, defensive. Those are intentions. Strikers, phambili. Okay, it's starting to sound like a crime. Defensive strategy, slender summer catalog. He proposes a tournament, several sexual encounters, hoping for a World Cup, an actual relationship. Selena only wants to play a friendly, a loss for Uslava. I don't think I need to explain that.
Even you know where the danger is. You know where the danger is.
We do not talk about it here. We only hear about it from friends, colleagues, children our age.
Well, clearly the kids already know something. Thank you very much to that piece by Loti. And this is indeed bringing some truths and context to all of the work that we are doing. Again, welcome to all of you. We are in the WeMove Adolescent Health webinar, which is hosted by the Desmond Tutu Health Foundation and IAVI, or International AIDS for Vaccine Initiative. And we really move right along after that. And here, our next session, which is titled Engagement of Young People in Health Research. And this is presented to us by Dr. Rosemary Musesengwa, who is a senior researcher on mental health ethics in the Global Initiative in Neuropsychiatric Genetics. In short, it's known as NeuroGen-E unit, the Wellcome Trust for Ethics and Humanities. She is also a member of the NIHR Global Health CEI Advisory Network, a global collaboration supporting the development of CEI in NIHR's global health work. I imagine that, Rosemary, the CEI is community engagement. I am not sure you're going to tell us, but she's with the Department of Psychiatry at the University of Oxford. Over to you, Rosemary, and welcome. And please take us through to some of the of those acronyms.
Hello, my name is Rosemary Musesengwa. I am from the Department of Psychiatry at the University of Oxford. I'm originally from Zimbabwe and have worked in Africa for close to 15 years. I would like to talk to you today about engagement of young people in health research. I would like to share with you some of the philosophical underpinnings of involving young people in health research, and also to share some of the programs that we have done to involve young people in health research in my previous work. So to set us off, I would like us to talk a little bit about what we term young people's participation or engagement and involvement in health research. And I particularly like the definition that was put across by Rai in 2012 that says it is a process where young people as active citizens take part in, express views on, and have decision-making power about issues that affect them. I like this definition because it describes young people's participation as a process, and it describes young people as active citizens, not passive citizens. And also it talks about that young people have a decision making power to talk about issues that are affecting them. So I will use this definition as we go along the presentation. Why do we engage young people in health research? So we have seen in literature that historically, young people are underrepresented in health research. And now we want to promote agency as well in young people, for them to have the capacity to choose, act, and influence matters in their everyday lives. We also want to develop accessible, relevant, and specific interventions for young people. When we also look at the outcomes of health research, we find that research that includes young people and their unique perspective and lived experiences results in better outcomes. Several justifications have been put across for the involvement of young people in health research. They are rights-based justifications that a young person has the right to be involved in anything that includes them and that is for them. There are also empowerment justifications for participation to empower young people as a social group. There's also the developmental justification, where participation is a way to achieve individual and personal development. There's also efficiency justification, where participation is a way to improve service delivery, policy, or practice. And whichever justification that is utilized is key in how you're going to involve young people in research. So let us look now at the levels of involvement and responsibility that we are putting on young people when we involve them in health research, young people who have been traditionally excluded from health research and interventions. So I want to talk here about the ladder of participation. And Rai also puts across that participation ranges from passive involvement to youth-led research. If we look at the bottom of the ladder, you'll find that there is manipulation, there is decoration, and there is tokenism, which in actual fact we do not consider as involvement of young people in research. And then as we go further up the ladder, we also see there's much greater involvement, and there's also a much greater level of responsibility that is put on young people to be able to make decisions right at the top there and make shared decisions with adults. And this being the best and the gold standard that we want to achieve. However, projects, according to what they want to achieve and according to what they need to do, they also need to consider at what level on the ladder they are operating on and on the various issues on how they're going to carry out their engagement. I also want us to look at the various stages that we involve young people in health research. So there has been a rapid review of evidence that was done by the Wellcome Trust in 2020. And as you can see from the graph, you will find that young people are mostly involved in the research design, data collection, data analysis, dissemination, and knowledge translation. This is where the bulk of the young people are involved in health research. And very few at the beginning of research, where there's the agenda setting and a considerable dip in the funding issues. And another review done by Sellers and Pavarini, 2019 and also 2020, you find that the most used strategy for young people's involvement in health research is by the formation of young people's advisory groups. And these facilitate greater involvement of youth in health-based research, as evidenced in mental health research. So how can we involve young people? What are the kinds of activities that can we do to involve young people in health research and in matters that involve and include them? I want to share with you a couple of projects that I've been involved with that will show and sort of demonstrate to you what we have been doing to involve young people in health research. The first project I want to share with you is the Mabisa project. So this project was being run in 3 countries, Zimbabwe, Botswana, and South Africa. It was on malaria and bilharzia, and we were working in a place where there was a lot of climate change issues. So what we did when we arrived in the area, we were much concerned about malaria and bilharzia. And as we were doing our participatory rural appraisals with the adults and the young people, we then discussed how we can involve young people in this very important research for their communities and how they could contribute. We had already formed a community advisory board with adults that you see on the picture on the left. And from that community advisory board, they then nominated young people within the community that were able to become citizen scientists who could assist us with the community projects that we wanted to do. So we sat down with the young people, we trained them in research and to understand various stages of research. We trained them on their responsibility, we trained them on research ethics, and we also trained them to become citizen scientists to be able to collect data for their climate change projects. The role of the young people were to observe climate factors and record diaries, to do evaluation activities, and to also assess the accuracy of their predictions, to also do some prevention activities, to do prediction activities that would feed into the Ministry of Health, and also to run awareness campaigns and inform people of the signs and symptoms of malaria and bilharzia, to also to seek early treatment, and also for them to be able to do climate weather predictions as well, because weather predictions affected not only their agricultural seasons, but also the coming on of malaria and bilharzia season as well in their area. So with this, with the involvement of young people, we discovered that this was a success. This was one of the major issues that ensured our success. This ensured our success because the young people then also trained the other young people who were up and coming. So as they left for college or as they got married and left the village, they would also train other young people to continue doing the citizen science work that we had trained them to do. So this has been a sustainable program since 2016 in the Gwanda district, specifically in Zimbabwe. The other project I want to share with you is the Amari Mental Health Research Initiative. We had it is a capacity building program, and it has a huge component of community and public engagement. One of the major engagement activities that we're doing was to engage young artists for them to be able to also help us in recruitment of young people into mental health research and to raise awareness of mental health within their communities. So I will talk about the activities that were specifically meant for young people. On the left, you will see a young man that is in the studio. So we had a young artist mentorship program. Claudius was a young man who was a mental health patient and became a mental health participant in the Youth Friendship Bench. And as he exited the program, we also now engaged him to be our Mari mental health ambassador. And he would go out to other young people, recruit young people for any programs that we had. And also, he also started the Young Artist Mentorship Program. On the right, you'll see the members of the Zimbabwe Union of Artists, and they helped him to sustain this program, and it is still running. And they've released a mental health album, and we have increased awareness in all the communities that he goes to, where he plays music on mental health issues and he mentors other young people on mental health issues. The other thing that we also did was to hold what we called a Think Fest. So this was an idea from young people in the areas that we were working in, and areas where the Friendship Bench was also running, that on the World Mental Health Day in 2019, they started what they called is the Think Fest. So the Think Fest involves a walkathon that is led by young people and youth friendship bench buddies. They also have theater competitions, they have poetry competitions, they have music competitions. So as you can see, the guys holding the posters, they're having their music competition, they have their dance competition. So this has become a regular activity within the communities. And this is where we also go and recruit our young people for mental health research activities as well. And this has helped to sustain increase in awareness on mental health issues, specifically on suicide prevention. The other program that we're still running is the Creative Arts Competition. This is in a different suburb in Zimbabwe, where one of our mental health PhD students, Dr. Clements, also runs this Creative Arts Competition every year. It started in 2020. So this was also an idea from his social inclusion project that he was doing for his PhD. And this project is looking at young people with HIV, with the diagnosis of HIV and also mental health. So he was looking at those with a dual diagnosis. And as he conducted his research, he was also doing quite a lot of community engagement work for social inclusion and to come up with solutions to combat stigma and also to increase awareness of mental health within that Mfakose community in Zimbabwe. The other program that was also running was being run by Primrose, who is another mental health PhD student, where she's been running workshops for mental health community engagement for people living with HIV, including young people. This is in conjunction with Zandiri, Africade, Friendship Bench, the Tendai Project, ZNNP Plus, which are all programs that are running projects for young people who have been diagnosed with mental health issues and HIV. I've also put down the link for our YouTube channel where you can see some of the videos that we have created and some of the content that has been created from all this engagement by the students and by young people. We've also just started doing the Kombi initiative. So the Kombi initiative is being run by the Youth Friendship Bench in conjunction with the Mari. We went out, talked to young people and asked them what is the best way that we can help you to raise awareness of mental health issues, especially so for substance abuse. And we are still working on that project. It got a little bit delayed because of COVID, but it is now up and running, and they're holding workshops to see how they can help and how they can continue with the paintings and with also the Kombi taxi initiative. And the last program I want to talk about is the MDIA program, which is the Ethics in Digital Mental Health for Young People in Africa. So this started out as a networking project and was not supposed to be online, but it ended up as online engagement because of COVID. So as we talked to the young people and explained to them that we had to stop the program until after COVID, they also then came up with an idea that let us run the YPAG as an online YPAG until after COVID. This was very successful. We had 80% attendance during lockdown. We have 14 members, 2 to 3 per country. The age range is 18 to 25. And they have peer-to-peer training with the early career researchers that are part of the MDR program. They're also co-producing the MDR Phase 2 application. And they also ran and designed an MDR digital mental health campaign on Twitter, Facebook, and WhatsApp. And what were the challenges of doing engagement online? The challenges include accessibility, digital exclusion. It will affect the diversity within the group because it's a particular young person who is only able to have a gadget and to get access to data. Though we were reimbursing them for their data, but to get access or to get a place where they could get Wi-Fi or to get the data was a challenge. Privacy is also an issue with African young people, to find a place where they can be absolutely private, to hold meetings and to talk about issues that affect their mental health, or to participate in health research where they have to talk about their mental health issues. The other issue was language with the online young people's program, because some of them, they don't speak English as their first language. Some speak Swahili, some are in South Africa, so they speak Afrikaans. And it became a little bit challenging, but we managed to retain all our young people, and the program has continued and hopefully continue into the next phase. What are some of the key considerations that we want to look at? Look at research versus health programming. When you involve young people, especially in Africa, the issue of health programming versus research is quite key. You need to think about that very carefully, not to confuse young people. Look at the social context. You get youth culture. How do they communicate? How do they communicate with adults in their community? How do they speak to each other? What do they like and what do they dislike? It's a lot of formative work that you have to do. Look at the literacy, basic literacy, research literacy, and for us also digital literacy. And no program, no youth involvement program fits, no one youth involvement program fits everyone. So you need to engage with young people and talk to them and ask them what they want and how they see it. And they can be able to tell you what they'll feel comfortable to do and what they don't feel comfortable to do. And also conduct evaluation at every level, either qualitative or quantitative. There are many tools out there to assist you with evaluation so that you can change your program as and when it is needed. Say thank you to Amari, MDR, and Mabisa, and most importantly to the young people that I've worked with in Africa for such a long time. And thank you, Majita.
That was Dr. Rosemary Musesengwa. Thank you very much, Rosemary. That really is really a showcase of the practices that are effective in engaging young people in research. And I think this also applies in just generally in development. And I think you highlighting us that young people's participation is a process, and they must have active participation as citizens, and they have decision-making power about issues that affect them. And I think we have really seen that in all of the programs, examples of a program that you have shared, which I think were exactly informed by young people who they are meant for. So really, thank you very much. We'd like to also apologize about that glitch in terms of the presentations that were not clearly visible, but as we are really promising that we will be able to share this with you. Now we move for the remaining 30 minutes to have an engagement. This is where you all come in, and I think at this point, in fact, just before we move to that, I'd really like to give a shout out to all of you who are joining us from the different parts of the region, Zimbabwe. So Rosemary, you are represented to Zambia, Tanzania, Malawi, Kenya, Uganda, the Democratic Republic of Congo or Congo Kinshasa, Nigeria, Lesotho, and of course, South Africa, as well as the USA. I think this is really a great representation of the African region, and of course, with all our global North partners. And again, you are part of the WeMove webinar, which is the 5th of the 6th series that is brought to you by the Desmond Tutu Health Foundation, as well as International AIDS Vaccine Initiative. Now we go to our panel, and we have our panelists that we're going to introduce. We have John Mdluli. John is the head of community engagement under the Oram Institute Clinical Research Division. John is also the head of the Secretariat for the South African Health Technologies Advocacy Coalition, which is known as SATAC in short. In his current role, John oversees the community engagement initiatives in 4 of the Oram's CRT sites. He also has experience in TB prevention trials, including TB vaccines, TB treatment trials, testing safe and effective novel drugs, as well as HIV treatment, ARV treatment, HIV prevention, vaccines. He's worked on some of the, I guess on most of the HVTN, which I think Michele has shared with us, HV10 702, 107, 108, 111, 703, including the microbicide trials that have really taken place and were led by the Oram Institute. Thank you, John, and welcome to you. And we're really excited to have you as part to really be sharing with us experiences of community engagement and all of the research work that you have been involved in. Again, I think true to what Rosemary has told us, we have a young person, and her name is Simthandile Mputa. Simthandile is a College of Cape Town graduate. She's part of the African Women Rising Organization. She is the newly elected chairperson of the Mdluli Desmond Tutu Health Foundation Research Center, and has really been part of our youth camp, and she has really risen in supporting research as a young person, and now she is a young woman feminist, a facilitator and a youth advocate who is passionate about community engagement and community building. Simthandile, we hope we can see you. We hope you have enough data to be able to show your face, but if not, the picture that we are seeing is also good enough. And thank you for joining us today. So we are going to invite the panelists to make their first comments on the presentations, and then we are going to take all of your questions. Again, thank you very much for introducing yourselves, and this space is for all of us. We have quite some time to be able to really engage on a number of issues that have been raised here. So I think I'll just really open it up, and I will begin with you, John. Please give us some of your core opening remarks on this. And Michele, we see you and we appreciate you. We know it is 6 a.m. In Seattle. So thank you very much for making it to this meeting. Over to you, John.
Thank you very much, Ntando. Thank you, everyone, for the invite. Ntando, I must say that the 2 presentations from Dr. Michele and Dr. Rosemary were quite interesting. I mean, looking at how Dr. Michele has taken us through the utilization of robust engagement in HIV prevention, where she spoke about the framework consisting of 5 key areas, where she took us through the engagement of priority groups and how to utilize CAP in our community engagement efforts. And most importantly, I was fascinated when she spoke about the early engagement of communities. And once you have engaged these communities early, you then need to come up with your marketing as well as your communication strategies, because we have seen the 2 interlinking. And thank you very much, Dr. Michele, for that insight. And then moving to our next presenter, who is Dr. Rosemary, who took us through the engagement of adolescents. And what I found to be very interesting in her presentation is how she kind of used some practical projects and as examples that have led towards successful engagement. And I was fascinated, Dr. Rosemary, when you spoke about the ladder or the hierarchy in terms of participation and the influence or at each level or on what it can do in research as a whole. But most importantly, maybe before I conclude, Ntando, it's how she has defined the context, looking at how can we engage the adolescents from their own point of view, because we tend to make decisions for adolescents and young people with the assumption that we are adults and we know better than they do. But what is important is that they also are human beings. They've got their own frame of reference. And most importantly, this is the group which is highly affected by HIV, especially young girls and women. So as a result, I think Ntando, as we are engaging and developing these interventions, let us always put it in mind that we are dealing with independent people who've got their own frame of reference and who are highly influenced by their peers than their families. And from Dr. Rosemary's presentation, I think it was well presented. And thank you very much, Dr. Rosemary, for the insight. I greatly enjoyed both presentations. Thanks, Ntando.
Wow, John, thank you very much for those reflections and really highlighting the message about how important it is to recognize that, you know, communities, be it adolescents or adults that we are working with, are individuals of their own, but they are also part of the bigger community. But I think in particular, I really like the idea of recognizing that when we work with adolescents, we're working with citizens. And often as adults, we want to be paternalistic and really want to engage with them as children, telling them what to do and not hearing from them. And I'm sure Simthandile is going to agree with us because she's one of those young people who have really worked with us when she was even younger than this. And now she calls herself a young feminist. Simthandile, I was looking, and in your video you had, I think, Grandma or Ma. It was nice to have her join us as well as part of this engagement, but it's fine where you are, but say hello to her. But please tell us what your thoughts are about this subject.
Okay, thank you, Ntando. Can you hear me?
Yes, we can hear you.
Okay, so what I would like to say, especially for the first presentation, it's basically a comment of saying that it is true the involvement of the cabinet in any stage of a research is quite impactful, because in that way the researchers are able to conduct something that is within the community's needs and within the community's understanding. And by the time that it gets enrolled, the community already knows about it and they are informed and they want to grab more of it. And also allows the community the opportunity, once the studies are done and the results have been submitted, they are then able to create a sort of advocacy in order to get those things from the government, to make sure that the government provides for them. And then what I like about the adolescent one, the second presentation is the involvement of young people. I always say this, that young people, we have our own style, our own volume, our own choice, our own way of doing things. And it's always nice to know that you are involved in each and every decision that is regarding you, in order for us to shape ways the way that we would feel comfortable on. See, the way things that were done before is not the same way things can be done now. It's not the same way that we engage with each other. You understand? And having us being part of things that are worldwide changing, it shows that we are valued, and in that way we are able to open ourselves up further in terms of being active, in terms of
well, the disappointment of internet, but I think we're really hearing the energy from what Simthandile is telling us about the involvement of young people, and in fact the importance of really bringing them on board as early as possible in all of the programs that are about them. And this is the opportunity to really hear from you, and hopefully Simthandile is going to be able to join us. But hey, Ghana, I'm sorry, we missed you, Ghana. So please, if we're missing your country, just write it there so that we give a shout out to all of you. And I think we really appreciate, because this is an opportunity for us to engage with you. You have many options. You have the chat box to either introduce yourself or put in your questions. You have the question and answer option, and do like many of you, like Vincent has done, Ali has done that, Ratanang has also done that, because this is an opportunity. And in fact, we're happy to open it up so that we even hear your voices about what you think and your questions about our subject and topic today. And so Suzanne says, I think this is a nice platform where people meet with the same interest. For me, as a counselor stroke psychologist, I really need other people for exchanging ideas and want to treat or help the people with different problems. And their WhatsApp number is there, and please connect with Suzanne, because that is exactly what this is about. And I see that Dr. Rosemary, you feel you are representing Ali, because all of your projects are happening in Uganda. So please send your questions. Now I will quickly also go back to John. And John, it would really be great, as we have seen some of the examples in terms of engaging young people, and maybe hear from you from some of the experiences and some of the things that you feel are really key and important in terms of your experiencing in engaging young people. And in fact, what have you seen? Are you able to tell us the difference between, when you did less of that active engagement of young people or communities in research, and when you have actually done it in a way that is satisfactory? You will have to unmute, John.
Oh, thanks, Ntando. I was going to say, as you might be aware, that in one of our clinical research sites allocated in Rustenburg, we have done quite a lot of work amongst young adolescent girls with IAVI. And what we have realized really was that there are factors that one needs to take into account, especially if one is to work with these young people. And for example, most of them are not employed, but they are at school. So when you develop any intervention, please bear that in mind, to say they might not be available at the time when you need them for their follow-up study visits. And if you are to design a trial, do you accommodate schooling? Secondly, much as they are independent, they are still kids in Ntando. They don't own their homes. They are still under parental care. And some of them are usually under 18 years. And the reason why we are designing trials which involves the under 18s is because we have seen that's where the HIV concentration is. So, and unfortunately, by the law, they can't give consent to participate in a clinical trial. And this is where the issue of an assent comes into the picture. And thirdly, they are still, as indicated, they are still under their parental care. So in a way, without any compromising confidentiality, you need to find a way of engaging, or a way of engaging with their parents in order to get parental support. Because we have also seen some of the interference between the willingness of a young person wanting to be part of the clinical trial and the parent giving instructions that you can't participate in a clinical trial, you are putting yourself at risk, you should be concentrating on your schoolwork. And as we know, Ntando, they are highly influenced by their peers. They've got their own context as far as the life is concerned. So one of the best things that we did as a site was to ensure that we create the environment which is user-friendly to them. And what I mean by the user-friendly environment, I simply mean creating the adolescent-friendly clinic. And when you do that, really, you need to have things that will keep them entertained. You need to have things that will help them perform their schoolwork, especially if they are to come for their follow-up visit after school. And we also know for sure that a lot of them will have daily homework to complete. So if you say to them, come to the site, that might consume a lot of their time. So we have also put in place some assistance as far as the homeworks are concerned. And when I conclude, Ntando, I also want to indicate that we even went further to have two separate caps. So we've got an adult cap, we also have an adolescent cap. And in most instances with the adolescent cap, the meetings are held over the weekend rather than during the week, so that we don't interfere with their day-to-day schooling work. Not unless if it's school holidays, then we'll have a meeting during the week, but we try to have this over the weekend. And if they come for their follow-up visit, we also make sure that we go fetch them, and when the visit finishes later, we also deliver them home.
Thank you, John. No, that's really great. And I think, again, the themes are really similar. Create, recognize who they are. In fact, recognize that they are part of the community as much as they are individuals, but also listen to them more and really provide spaces where we are able to hear from them, but also not just hear, but be informed by the communities or adolescents in all of the work that we are doing. And I think, Rosemary, a part that I think you would like, but also just respond, I mean, also speak to some of the points that you probably would like to highlight from your presentation. But John has highlighted an important aspect of ethical research in adolescence, which often brings a dilemma when we actually do research with regards to issues of assent and consenting, etc. Maybe you'd like to touch on that, and we'll probably just after you hear from Michele, and maybe go to some of the questions.
Okay, thanks, John, for that for that comment on assent. Yes, so if you look at most of guidance documents, they talk about consent and assent in a very westernized manner. And like you say, in our culture, in African culture, as long as you're still living under my roof, even if you're above 18, I still pay your fees, or you still eat my food, as my mom used to call it, you are still liable to ask for permission for a lot of things. So in our research, as long as an adolescent is above the age of 18, they can consent, but we also take into account the context from which they are coming from. If they're below 18, we have to have parental approval as well. So they need to consent to their young people being involved in a particular research. So you need both approval from the parents. And then on the other side, like Ntando said, that it becomes a dilemma sometimes. For instance, in mental health research, they might not want like their other siblings to know, then privacy becomes an issue. So it's much less of the westernized privacy. When we talk about privacy in the Western context, it's about data privacy and other things. When we are doing research in Africa, it's actual physical privacy we are talking about. So that also affects even the assent process. The young person will tell you, yeah, but you see, for you to access my parent, you actually have to come home. And when you come to my house to talk to my parent, my other siblings are going to ask, who is this and why are they here? And why are they asking about the other sibling? And for us, for digital mental health, we actually found another issue that, they might say yes, but you might need to have a whole discussion with the whole family because they now need access. Sometimes they have one gadget for 3 siblings in the house. So privacy becomes a serious issue if you want to have a session with one of the young people in the house. It means they have to download an app sometimes. They have to have the phone for certain periods of time. And now everybody knows their business. And young people are particularly sensitive to that, to say, I don't want my other siblings knowing. I don't want my friends from school knowing. that I'm part of this research, even if it's not mental health research, even just asking about malaria, they'll tell you, yeah, I don't want them in my business. They take their, it's youth culture. They say it's my business. They take that very seriously. So that's where the dilemma comes in, that at some point you have to have a discussion with the young person to say, even if you really want to join this, you might end up having to involve your parents because you're below 18, and your other siblings or some of your friends might end up knowing about this. And how do you feel about that? So that becomes part of the assent process, to say, think about it carefully before you join, because inadvertently we might end up exposing you with, not because we want to, but because the law says we need assent. So yeah, I'll leave this for Michele and tell us maybe in the Western context what that means for assent in young people, and they don't want to be exposed.
Yeah, well, the consenting, and in fact, Michele is really, as we have heard from John, a lot of her work is actually also happening in this region, which is interesting. As you say, she's up in the north, but the application of the work is happening here. And in fact, one of the things to add that, because I think the conversation is really touching on the ethics of engaging communities and the ethics of engaging young people. And one of the things that I know that HV10 and CoVPN have done is to actually bring young people into protocol development processes. And now somebody would have said, oh no, they're probably not going to understand that 114 page for them to review and give input. And Michele, what are some of your thoughts with regards to those processes and your experiences?
Yeah, thanks, Ntando. So I think it's really important to make sure that people have the capacity to show up and contribute. And one of the things that we do for all community members, including our adolescent community members, is to, provide them the knowledge to be able to contribute to the protocol and to really own their expertise, because they are an expert in the room and bringing their expertise from their lived experience and from their community. So I think that that's really important, to make sure that people have a voice at the table, because as you said, Ntando, it's not only important to bring people in to contribute, but to also make sure that they have the power to do so, and that when they're in a room full of scientists who may at times be saying things that they don't understand, to acknowledge that there are points in time in the room where everyone doesn't understand, and to ask questions and to make sure that they have a baseline understanding. And then, as I said, we provide some training to build capacity around that as well. So that really is a strategy that we have. And when we do have our protocol teams, often the teams break out into specific content areas. And someone from our team is often paired with our community members who are on the protocol team, and we're able to answer any questions at that time and really focus on some of the areas that are specific to community engagement, including the informed consent form or the assent form, as Dr. Rosemary was discussing.
No, thank you very much, Michele. I mean, there's so much to talk about, and as they say, time flies when you're having fun, because we're really going to approaching the end of our session today. But I think I'm going to give each of the panelists an opportunity to really highlight something that is burning within your heart about this subject. And I think as part of that, Iman is asking, what is the main thing that is missing from engagement with young people? In fact, what it is that we can do better. And so I think for each of you to really have that opportunity, because it really brings us to what exactly we should be doing to do better. I see that Tato has raised their hand. Yeah, and I mean, let's see, fun times, let's see how that works. And Dr. Rosemary, please elaborate further on how you equip young people to become citizen scientists. That's interesting. What are the requirements and how extensive is this training? How does one start thinking about replicating this approach? How can we take it to scale? And Yvonne is asking on the onus of, remarking that the onus is on the researchers to simplify language, even for protocols. Does the panel have experience in engaging young people in study design and protocol writing, rather than engaging young people with a ready protocol? Interesting. And I think, Michele, this is one of the areas. And in fact, John, that you can speak to. In fact, Simthandile, you can actually speak to your experiences as a CAB member, how you have been involved in this process. But I think just like before I give to you all in the 5 minutes that we do not have, I will also give to Tato to actually ask their question. Over to you, Tato. Well, Tato, if you're asking, you are on mute, so please do unmute and ask your question.
Sorry, Ntando, I didn't mean to raise my hand. My apologies.
Well, now you are here. Maybe we can hear you quickly in one line. What is this that you're thinking about this that even made you to raise your hand unintentionally?
Oh, okay. No, it was to Dr. Rosemary. I think the approaches to engaging young people were very interesting. Even the artists and tapping into what the young people in that community actually like and how you can relate to them and help them even just with the art that they have, but also help them be able to spread not only awareness, but also skills was very interesting. So the question I had, you mentioned Ntando, so I would just like for Dr. Rosemary to please shed some insight on that. Yes, thank you.
Thank you very much. And I see that Pemberai has also raised their hand, and perhaps it's so unfortunate that we don't have enough time. But Pemberai, please just write your remark. And I think one of the beautiful things about this is that it is being recorded, number one, and number two, it will be on the Desmond Tutu Health Foundation YouTube channel. So please go there and we can continue the conversation there. So I'm going to give each of you 30 seconds to try to answer those questions and also, give us some of your remarks, including Simthandile. Can you please begin with Simthandile? Simthandile, it's so unfortunate, for all of you in other parts of the world, we have load shedding in South Africa. So that makes us, to have cuts when we are having this kind of engagement. Over to you, Simthandile, your last remarks, and I'll give you a minute.
Thank you so much, Ntando. I appreciate that so much. Okay, so now my mind is moving all over the place. But however, I just wanted to thank the presenters for the opportunity of what they shared. And also to highlight that, for example, when it comes to protocol, it's always nice to when it comes to young people and you trying to make sure that the young people understand the protocol. As for our CAB, what we are trying to do is have a protocol training whereby all the young people and all the CAB members basically understand how to go through it, which parts are important, and which parts are more much of a community involvement knowledge that we can capture, and how can we translate that to our communities. So it's also good to do that. And it's also important that your CAB is compiled by people who are very much active in their community, so that you know that the information that they get, they do pass it to the communities. And also, what do young people need? What do we want? We want to be involved. That's what we want. We want you to ask questions to us. What do we need? How do we see ourselves protecting each other? How, what having sex at a young age means, what falling pregnant means, what does HIV mean to us in our communities, in our environments, with our people and how we live. So ask the questions. Don't come with answers of questions that we never asked, because you won't know what it is that we truly need.
Thank you.
Yes, I'd like to thank everyone for that. Thank you so much.
Thank you very much. Brilliant, Simthandile. I mean, those are very clear points. Rosemary, Michele, John, each of your 30 seconds.
Okay, I think I have the most questions, but in terms of training, so what we did, so I'll tell you what we did and how it worked. So we asked them, we had a participatory rural appraisal workshop. So we asked them what they knew about research. And then we came up with things that we understood, we noticed that they did not understand. So one of the things that we did was to do some training on research literacy, just to say, what is research? how is it different from what happens at the clinic, and why does it sometimes happen at the clinic? Because that was very confusing for them to understand the link between program work, health delivery, and research. So those three need to be ironed out so that people understand, young people understand. Then you also need to go through literacy for the particular subject matter. So if it's mental health, you need for them to understand the different aspects of mental health, what that means, and what is their role. If it's HIV, similarly, you need to make them, you need to train them on what that is. And the training is really training for young people. It's not the training that we do like here, sitting, talking to each other like we are doing. Yeah. It's very different. For young people, you have to ask them like, what kind of training do you need? For some of the training, we did it through drama, some of it through poetry. So we would ask them to write a poem about malaria, like for the Mabisa study. Then would pick out misconceptions and then talk about them, and then would go on and on and on. And then one other thing is there is actual online training. There is the GPP, good participatory practice. The training is actually on right now. I think they sent in an advert. Yeah. And then the HVTN also has a portal for CAB training. So this is training for lay people, how to look at a proposal and how to give input and what their role is when they give input. So there is also actual formal training, but you can design your own training from these materials. That's what we did. Yeah. For young people, let them design the process. So you tell them, I want to help you with, like for us, it was a digital mental health app. So they told us how we could get to the end product, but the how part, the process, the young people told us, you need to do this, you need to educate people, and these are the types of apps that we use, and this is how we call A, B, C, D, E, because remember, they are youth culture. They have ways in which they call certain things. So we had to use that kind of language and so forth and so forth. Yeah, we've also got publications. I can share them with Yoliswa, and yes, as they sent through the presentation, you can also get some information from there. Pembela, you know where to find me if you need more information. Brilliant.
Thank you very much, Rosemary. I get the message that we're not going to be stopped by time. There's so much for us to discuss. But I think, as I said, for people really, we will redirect you to the Desmond Tutu Health Foundation YouTube channel, and we can really continue the discussion. And as you can see, our panelists are nodding because they will also join there and continue the discussion there. Michele, any last thoughts quickly?
I think that Dr. Rosemary made a wonderful summation of what we just discussed. So I will leave it there, and thank you for having me.
Brilliant. Thank you so much for waking up at 4 a.m. to be with us at 5 a.m. And I can see, and now the day is about to begin for you. Really appreciate that. John?
Thank you very much, Ntando. I think Rosemary has said a mouthful because I wanted to comment on the language. So the language does not start at protocol review. The language does not start when you are a member of the protocol development team. You need to empower a young person based on their training needs and the understanding of the content you want or the message you want to put forward, so that they are empowered enough to be able to contribute effectively. Thank you very much.
Oh, thank you very much to all of you. The WeMove webinar. Thanks to Simthandile Mputa, the youth CAB member of the Desmond Tutu Health Foundation Mdluli Center, John Mdluli from Oram Institute, Dr. Michele Andrasik from HVTN, CoVPN, and Dr. Rosemary Musesengwa. I mean, there are those many affiliations that I thought you would break down for us, but at Oxford University. And thanks to the Desmond Tutu Health Foundation and the International AIDS Vaccine Initiative for hosting this webinar. And really thank you to all of you, and many of your questions. I'd like to let you know again that I have in the Desmond Tutu Health Foundation have a wonderful opportunity for early career researchers that are interested in HIV and health research with adolescents, and the link is shared on the screen and in all the the Desmond Tutu Health Foundation social media platforms, and we have applications that are closing in the middle of the month for this opportunity. Please note that as you exit the Zoom platform, at the end of this webinar, a very brief evaluation will pop up. So please tell us how we are doing and what it is that we can do better. And again, as you are telling us about that, we apologize about the clarity that was lacking on the presentation, but we'll work to send those to you. Otherwise, thank you for taking a moment to complete the evaluation and being part of this and engaging with us. Your feedback is going to help us to improve the webinar series going forward. This session has been recorded and will soon be available to view at the DTHF YouTube channel. Thank you very much to all of you, and thanks to the Desmond Tutu Health Foundation for all those who have made this possible. And have a lovely afternoon and a good morning to all of those who are joining us from other parts of the world.